Since 2004, WoundCareJobs.com has been the online market-leading career empowerment resource for clinicians currently specializing in and those interested in pursuing careers in wound care. WoundCareJobs.com is the only wound care specialized venue that continuously and actively drives both active and passive job seekers to featured jobs, those posted directly to WoundCareJobs.com. Today's healthcare environment can be challenging and is continually changing. New policies are being enacted on a regular basis. One such policy addresses hospital-acquired conditions, or HACs. Medicare is no longer reimbursing hospitals for specific hospital-acquired conditions, including pressure ulcers. Now, in the event these wounds occur, the hospital is responsible for the treatment costs, which often run into the tens of thousands of dollars. In addition, the hospital may be cited on publicly available websites, such as Medicare.gov Hospital Compare. Recent estimates indicate that 1 to 3 million people in the U.S. develop pressure ulcers each year. According to the Joint Commission, more than 2.5 million patients in U.S. acute care facilities suffer from pressure ulcers. 60,000 die from pressure ulcer complications annually. The Centers for Medicare and Medicaid Services, CMS, reports the cost of treating a pressure ulcer in the hospital setting as a secondary diagnosis is over $43,000 per hospital stay. Due to our aging population, obesity, and the diabetes epidemic, we are facing a challenging time, during which the prevention of pressure ulcers couldn't be more important. In our current healthcare environment, no hospital can afford the cost or stigma associated with hospital-acquired conditions, such as the development of pressure ulcers. So what's the best way to prevent such financial and reputation catastrophes? Effective, evidence-based wound care prevention and treatment programs. Wound care programs and the policies supporting these programs are established and managed by experienced wound care clinical professionals, such as WOC nurses. If you don't have experienced wound care clinicians on staff, your organization is at risk. As a staffing professional, you can have a significant positive impact on the financial well-being and reputation of your organization. Ensure all wound care positions are staffed with qualified clinical professionals. As you may be aware, if you have recruited for these positions in the past, they can be very difficult to fill. The reason? Supply and demand. There are significantly more open wound care positions compared to the number of wound care clinicians actively seeking employment. Therefore, differentiating your job and organization is a critical step to attracting both active and passive job seekers. How do you ensure your job is viewed by qualified wound care clinicians? Most job boards are static and designed for individuals to simply search for jobs. WoundCareJobs.com, on the other hand, is the only wound care specialized resource that continuously and actively drives both active and passive job seekers to your jobs. Our clinical community consists of a wide range of wound care specialists, from physicians to certified wound ostomy continence nurses or CWOCNs. For example, there are approximately 4,500 CWOCNs in the U.S. Of those, 80% receive the market-leading career empowerment e-newsletter, the WOC Skin Health Weekly. WOC Skin Health Weekly Career Empowerment e-newsletter features the latest jobs posted on WoundCareJobs.com. Our weekly newsletter circulation now exceeds 10,000 wound care clinical professionals, and it is growing daily. The WOC Skin Health Weekly is just one of the many ways WoundCareJobs.com actively drives wound care clinicians to your jobs. WoundCareJobs.com also features relevant wound care news, clinically focused market research, and well-attended wound care-focused clinical webinars. Each wound care clinician, upon completing the online webinar registration form, is actively driven to WoundCareJobs.com, as well as the jobs and advertisers featured on WoundCareJobs.com. When searching major search engines for wound care-related jobs, WoundCareJobs.com is often the #1 search engine result. WoundCareJobs.com now hosts an average of 500 unique wound care visitors per day, as well as a continually increasing social media following. For over a decade, employers have recognized WoundCareJobs.com as the only wound care-related venue that continuously and actively drives wound care clinicians to their jobs and advertisements. Currently, there are approximately 5,500 jobs on WoundCareJobs.com which require wound care experience, 4,000 within the U.S. alone. However, only jobs posted directly to WoundCareJobs.com are prominently displayed at the top of all relevant search results pages and actively driven to the wound care clinical community. Jobs listed at the top receive the highest number of views, thereby resulting in a substantially higher volume of qualified applicants when compared to jobs that are simply streamed into WoundCareJobs.com from job aggregators such as Indeed.com. WoundCareJobs.com offers job posts and job post packages for every budget, including 60-day featured and platinum posts, each with their respective advantages. Platinum jobs are highlighted with your banner or logo on the home, search, and all search results pages, as well as within the Platinum Employers section of the WOC Skin Health Weekly, ensuring the highest level of exposure for your jobs. WoundCareJobs.com offers the ultimate in job post flexibility intended to streamline the candidate application process, such as the ability to include a link to your website or career portal at no extra charge. Use as much text as necessary to effectively communicate the benefits of your jobs and your organization. WoundCareJobs.com offers the WCJ online chat career concierge service to assist job seekers to apply for your jobs. At WoundCareJobs.com, you won't have to wait for job seekers to hopefully find your job. Rather, jobs posted directly to WoundCareJobs.com are featured within the WCJ Job Mail Express section of the WOC Skin Health Weekly. Jobs posted directly to WoundCareJobs.com are featured on the WoundCareJobs.com social media venues such as Facebook and Twitter. Our commitment to actively driving wound care clinicians to the jobs and advertising featured on WoundCareJobs.com ensures that your jobs are viewed by qualified candidates, thereby expediting the recruitment process for difficult-to-fill wound care positions. Ensure your wound care jobs are being viewed by qualified wound care professionals. Fill your wound care jobs faster than ever before, and guarantee the long-term financial success and reputation of your organization. For more information on featuring your jobs on WoundCareJobs.com, please call 800-578-0948, extension 105, or email us at jobs@woundcarejobs.com.